Hey there viewers. The thyroid, also known as the butterfly gland, is a small gland that sits at the base of the throat. It is a component of the endocrine system which is responsible for producing hormones and thereby regulating the functions of the body. Despite the fact that thyroid cancer is a relatively uncommon disease, nearly 1,500 new cases of it are diagnosed annually. As is the case with other types of cancer, it may not be detected until it has developed significantly. In today's video, we're going to discuss 10 distinct warning signs of this cancer. Individuals who are able to recognize these warning signs may be more likely to seek prompt medical evaluation and treatment. Before making any changes to your diet, or if you have any concerns about certain foods and the impact they may have on the health of your thyroid gland, you should always speak with a professional in the medical field. Without wasting any more time, let's get started. One, lump or enlargement in the neck, thyroid nodule. One of the most telltale signs of thyroid cancer is the presence of a palpable lump or enlargement in the neck, known as a thyroid nodule. Palpable thyroid nodules occur in about 6% of women and 2% of men, with a higher prevalence in the elderly and in iodine-deficient areas. These nodules are typically painless and may be felt just below the Adam's apple. Most thyroid nodules are benign, but about 5% to 15% of nodules are cancerous. These nodules may result from the overgrowth of thyroid cells or the accumulation of fluid-filled cysts. Solid nodules have little fluid or colloid, a stored form of thyroid hormone, and are more likely to be cancerous. Approximately 90% of all thyroid cancers are differentiated thyroid cancer, 85% of which is papillary cancer. 2. Hoarseness or voice changes. Thyroid cancer may affect the recurrent laryngeal nerve, which controls vocal cord movement. As the tumour grows and presses on this nerve, it may lead to hoarseness or changes in the voice. These alterations in voice quality are often subtle at first, but may become more pronounced as the cancer progresses. A study says that laryngeal cancers constitute about 25% of all head and neck malignancies. They are commonly present in adults between 50 and 70 years old and show a strong male predominance. Tobacco alcohol use is known to be a major risk for laryngeal cancer. To support vocal cord health, maintain proper hydration by drinking an adequate amount of water daily. Avoid excessive throat clearing or straining your voice. Additionally, consider incorporating soothing foods like honey and ginger into your diet to alleviate any discomfort in the throat. Moreover, ensure adequate intake of vitamin C as it supports the health of the vocal cords. The recommended daily intake of vitamin C for adults is about 75 to 120 milligrams for women and 90 to 120 milligrams for men.
Make sure you join our millions of followers and hit that subscribe button for all of our great Bestie content.
Three, difficulty swallowing. Dysphagia. As thyroid cancer progresses, it may grow and invade surrounding structures, including the trachea, the windpipe, larynx or voice box, and esophagus, the tube that carries food from the throat to the stomach. When the tumour presses against or obstructs these structures, food and liquids have difficulty passing smoothly from the throat into the stomach. This may lead to sensations of choking or the feeling that food is getting stuck in the throat. There are several studies where thyroid cancer patients have shown symptoms of dysphagia. In one case, an 83-year-old woman had difficulty swallowing, hoarseness, weight loss, and a neck lump, which turned out to be metastatic thyroid squamous cell carcinoma. In another case, a 60-year-old woman also had a neck lump, swallowing issues, hoarseness, weight loss, and aspiration while drinking. She was later diagnosed with thyroid squamous cell carcinoma, which involved major blood vessels. 4. Persistent cough. Particularly when other symptoms like hoarseness or difficulty swallowing are present. A persistent cough that doesn't respond to standard treatments may be a sign of thyroid cancer. The tumour may put pressure on the trachea or windpipe, leading to chronic irritation and coughing. To ease coughing discomfort, consider using a humidifier to add moisture to the air, which may soothe the throat. Drinking warm herbal teas with honey and avoiding irritants like smoke may also help. Focus on maintaining overall respiratory health and engaging in regular physical activity to support lung function. 5. Neck pain or tenderness. Thyroid cancer patients may experience pain or tenderness in the neck, particularly if the tumour has grown or spread to nearby structures. The tumour pressing on the neck's nerves, muscles, or other tissues may cause discomfort that can range from mild to severe. The majority of the time, this pain will begin in the front of the neck, but it may also travel all the way up to the ears. In a study with 50 patients diagnosed with medullary thyroid cancer, 11 of them reported having neck pain prior to receiving their diagnosis. According to the findings, 82% of them often had their cancer spread to their lymph nodes compared to those without neck pain. Only if advised to do so by a doctor or other qualified medical professional should you apply warm compresses to the affected area and take over-the-counter pain relievers. 6. Swollen lymph nodes. We have lymph nodes located all over our bodies, which are made up of groups of immune cells that fight against both cancer and infections. These glands, which swell when we have an infection in the neck, are also useful in the fight against cancer because they stop cancer cells from spreading from the thyroid to the rest of the body. If there is an increase in the size of lymph nodes in the neck, under the jaw, or behind the ears, which is highly common for papillary thyroid cancer, it is possible that the disease has spread to the lymphatic system. 7. Difficulty breathing, dyspnea. The thyroid gland is located in the front of the neck, and thyroid cancer may cause the thyroid gland to enlarge, forming a tumour or nodule. In some cases, a large thyroid tumour may press against or compress the trachea, the windpipe, which carries air to and from the lungs. This compression may narrow the airway, making it difficult to breathe and leading to dyspnea. If the cancer has spread widely throughout the lung tissue, it may make breathing more difficult and lower the levels of oxygen in the blood. Studies have said that it is a significant complication and may be the cause of death in many cases, nearly up to 46%. However, you need to keep in mind that dyspnea may also occur after having surgery on your thyroid, particularly if the surgical procedure affects the positioning or function of the vocal cords, or if there is swelling in the neck post-surgery. One might experience difficulty breathing. 8. Fatigue and weakness. Thyroid cancer and some of the treatments for it, like surgery, radioactive iodine therapy or thyroid hormone replacement therapy, can change the amounts of thyroid hormones that are already in the body. The production of energy and the regulation of metabolism are both significantly influenced by these hormones. Any imbalance in the hormone levels, such as hypothyroidism and underactive thyroid, may lead to fatigue, weakness, and a general sense of tiredness. A healthy, well-balanced diet is often helpful in the fight against weakness. In addition to receiving medical treatment for your cancer, you should make it a priority to incorporate essential nutrients like iron, B vitamins, and antioxidants into your diet in order to combat the persistent fatigue that you are experiencing. Several studies have shown that fatigue is a common problem among different groups of cancer survivors, with prevalence rates ranging between 17% and 90%. 9. Unexplained weight loss. Although less common, some individuals with thyroid cancer may experience unexplained weight loss. The body's increased metabolic demands, changes in appetite, and altered utilization of nutrients may all contribute to weight loss, which is a common symptom of more advanced stages of cancer. You may also know that hypothyroidism refers to a condition in which the thyroid gland does not produce enough of the hormone thyroxine. Thyroid cancer or its treatments, such as thyroid surgery or radioactive iodine therapy, may be the cause of this condition. It may also slow down the body's metabolism, leading to weight gain or difficulty losing weight. People who had been obese in the past but had been successful in losing weight had a relative risk of developing thyroid cancer that was significantly lower than the average, with a hazard ratio of 0.89. According to these findings, a higher body mass index BMI, as well as a larger waist circumference, was significantly associated with an increased risk of thyroid cancer. 10. Loss of appetite. Anorexia, also known as a loss of appetite, is one of the symptoms that may be associated with thyroid cancer, especially in the more advanced stages of the disease. Abnormal growth of thyroid cells or tumor-induced hormonal imbalances may disrupt the body's metabolic processes. As a result, individuals may experience changes in appetite. In addition, the tumour may grow and spread to nearby structures, which may put pressure on the esophagus as well as other parts of the digestive tract. This physical pressure may lead to a sensation of fullness, discomfort, and a reduced desire to eat. It's important to note that loss of appetite is a non-specific symptom and may be associated with various medical conditions, not just thyroid cancer. If it continues for an extended period of time and cannot be explained, a medical evaluation should be sought in order to identify the underlying cause and determine the most effective course of treatment. What are the factors that contribute to thyroid cancer? A combination of factors, including those relating to genetics, the environment, and one's lifestyle, may result in thyroid cancer. There are a number of known risk factors that contribute to the development of thyroid cancer. However, the exact causes of the disease are not always clear. 1. Gender. Thyroid cancer is more prevalent in women than men, with women being 3 times more likely to develop it. This gender disparity is partly attributed to hormonal factors. Estrogen, a female hormone, may play a protective role, while testosterone, a male hormone, may increase susceptibility. 2. Age. The likelihood of developing thyroid cancer increases with age. Although it may happen to people of any age, the vast majority of diagnoses are made in people who are between the ages of 30 and 60. However, the best part is that it is an extremely unusual occurrence in children and adolescents. According to the National Cancer Institute, the median age at diagnosis is 51 years. 3. Family history. A family history of thyroid cancer or certain genetic syndromes may elevate the risk. For example, familial medullary thyroid cancer is associated with specific genetic mutations. Individuals who have a first-degree relative parent, sibling, or child diagnosed with thyroid cancer may face an elevated risk themselves. 4. Radiation exposure. Exposure to ionizing radiation, especially during childhood, is a well-established risk factor for thyroid cancer. The thyroid gland is particularly sensitive to radiation, and exposure may result from medical treatments such as radiation therapy for head and neck cancers or environmental sources such as nuclear accidents. Specifically, those who lived through the Chernobyl nuclear disaster have shown a significantly higher risk of developing thyroid cancer. 5. Thyroid conditions. Pre-existing thyroid conditions, such as goiter enlarged thyroid and thyroid nodules, may increase the risk of thyroid cancer. Chronic thyroiditis, also known as Hashimoto's thyroiditis, is an inflammation of the thyroid gland that lasts for a long time and is associated with a slightly increased risk. It is possible that inflammation and the growth of thyroid cells played a role in the development of cancer. 6. Dietary factors. While iodine deficiency was historically associated with an increased risk of thyroid cancer, this risk has significantly decreased in regions with iodized salt supplementation. Iodine is necessary for the production of thyroid hormones, and a deficiency in iodine intake may lead to goiter as well as dysfunction in the thyroid. 7. Obesity. Due to the fact that obesity is involved in both hormonal shifts and inflammation, it may be linked to an increased risk of developing thyroid cancer, particularly the more aggressive forms of the disease. 8. Lifestyle choices. There is an established correlation between smoking and an increased risk of developing certain types of thyroid cancer, specifically anaplastic thyroid cancer. Moreover, the carcinogens found in tobacco smoke have been shown to contribute to the development of cancer. 9. Genetic mutations. Mutations in particular genes, such as those in the RET and BRAF genes, are frequently found in thyroid cancer cells and may play a role in the development of cancer. These mutations may cause abnormal growth and division of cells, which may eventually result in the development of cancerous thyroid cells. Recognizing the warning signs of thyroid cancer is absolutely necessary for making an early diagnosis and having a better chance of successfully treating the disease. It is imperative that you seek the advice of a qualified medical professional for a comprehensive assessment if you or someone you know experiences any of these symptoms. The likelihood of successful treatment and long-term survival is significantly increased when the condition is detected at an earlier stage. Maintaining vigilance and educating yourself may help you make your health a top priority. Now that we have discussed the many signs of thyroid cancer, let's dive into other topics of interest. Interested in knowing more about tips and tricks to shed pounds easily? Let's keep the conversation going with a couple more weight loss related videos. Shall we? Watch 16 healthy snacks for weight loss you'll want to eat every day. You can also try our video on 12 diet mistakes to avoid when you're trying to lose weight. Go ahead, click one. Or better yet, watch both and learn more about weight loss and nutrition. Are you experiencing any of the notable symptoms mentioned earlier? Let us know in the comments below.